On September 7th, the Center on Health Insurance Reforms at Georgetown University, with support from the Commonwealth Fund, released a new report on medical debt. They wanted to evaluate the current landscape of medical debt protections at the federal and state level. They also wanted to see where some of those protections might be falling short. In their research, they did an analysis of state and federal laws. They held discussions with experts in medical debt law and policy, and they focused on some of those laws that are governing hospitals and debt collectors. And here are some of their findings. Despite the pervasiveness of medical debt in the United States, current federal protections leave many patients at risk, especially women, people of color, and low-income families. Some states have established their own patient protections against medical debt, but there's quite the variation in what those protections look like from state to state. If you read through the report, you're going to notice there's some data assessments, and they cover topics like how different states have adopted different levels of financial assistance policy standards, state set eligibility thresholds for financial assistance, state adoption of community benefit standards, state standards for hospital payment plans, and state limits on medical debt interest. And here's an example of one of those state-by-state assessments. What we're looking at is the state limits on medical debt interest. The states shaded in dark green prohibit interest for certain populations, while those states shaded in light green generally cap interest but aren't as aggressive as those dark green states. A couple other data assessments in the report: some state protections before a hospital can send a bill to collections, state limits on credit reporting of medical debt, state reporting requirements for hospitals on data related to medical debt protections, and state limits on wage garnishments to collect on medical debt. And again, here's a look at that state-by-state representation on wage garnishments to collect on medical debt. Some states offer much more protection than others. Some conclusions out of the report. Federal medical debt protection standards are vague and rarely enforced. They said patient protections at the state level help address key gaps in those federal protections. 20 states have their own financial assistance standards, and 27 have community benefit standards. However, the strength of these standards varies widely. Relatively few states regulate billing and collection practices or limit the legal remedies available to creditors. We link to that report in the description below.